When do we leave a tooth root behind? Yes, sometimes we actually do. Let's be real. Tooth extractions aren't always clean and smooth. Sometimes that little root just doesn't want to leave, like a guest who overstayed their welcome. But guess what? There are some situations where we intentionally leave the root behind. Sounds weird? Let's break it down. Conditions where roots are left behind. If the root fragment is very small, deeply embedded in bone, and there is no infection present, no sinus or nerve involvement, and no mobility, we may leave it to avoid damaging nearby structures. Trying to remove it could do more harm than good, like breaking a wall just to catch a cockroach. Inferior alveolar nerve, especially in lower molars, and the maxillary sinus floor, especially in upper molars or premolars. If the root is close to or at risk of displacing into the sinus or causing nerve damage, we avoid excessive trauma. Better to leave it in peace than turn it into a lawsuit. If the root is fused to the surrounding bone, removal could damage the jaw or even break the surrounding bone. If it's asymptomatic and infection-free, we leave it. In patients with bleeding disorders, poor healing capacity, or osteoporosis, the risk outweighs the benefit. If the root is non-infected and removal could lead to a pathological fracture or prolonged healing, we leave it and monitor. Sometimes during the exposure of impacted teeth, a primary root tip may be encountered. If it's sterile and asymptomatic, it may not need to be removed. But wait, when can't we leave it? If the root is infected, mobile, associated with a cyst, granuloma, or pathology, or at risk of migration to the sinus or soft tissue. So yes, sometimes dentists leave roots behind, intentionally and responsibly. It's not laziness, it's clinical judgment. If it's not infected, not moving, not bothering anyone, that root can retire in peace. Like, share, and subscribe, because every root has its reason.